Again, it's not a huge joint. I usually have the patient laying down. It's really easy for them, and they can be totally relaxed. So the one thing we're going to make sure of is you got to find your proximal row. So you've got your styloids, okay? You're going to come down radial and ulnar, and you're going to hold on. Right along there is going to be your distal row. So that's where you're going to make sure you stabilize. Then your other hand is going to go right up against, so all fingers and thumbs connecting, and we're going to be on the proximal row, okay? So then all you have to do there is a very slight distraction. So I'm taking the whole hand, my mobilizer, out, okay? So it's really simple, really nice and relaxed. It's just a simple distraction, okay? Very, very easy. Where what we want to do next is we want to add dorsal and volar. So I'm still holding on to that grade 1 distraction, and then or 2 or 3 or 4 depending on what you need, okay? And then what I'm going to do is I'm going to take it up towards the ceiling. So I'm pulling it up towards the ceiling to the volar surface, and then I'm going to push it down towards the floor, towards the dorsal and then the plantar, the volar surface here. So we've got, if we need to, we can even take the hand slightly off if you feel like you're touching your table, but you should have enough hold here. So we're going to do a slight distraction. We've got ceiling to floor, dorsal volar, okay? From there, we're going to do medial lateral. So I'm going to take the whole row that I've got in that traction, and I'm going to push it towards her body and towards me. So we're going to take the whole row and we're going to go medial and lateral. Medial and lateral. Remember, it's not a huge motion that happens at the wrist. Lastly, we're going to take and we're going to do a radial deviation, ulnar, radial. So what I'm doing here is I'm almost kind of moving both hands a little bit to create that. So I've got my stabilizer, slight traction, and I'm going to open and gap, and open and gap for radial and ulnar. It's very, very simple, okay, at the wrist. That's the simplest of all of the things that you can do with the wrist, okay? Now, if you feel like you can't get a good hold or a grip on the wrist, what you can do, for example, is you can change up. I could stand to do this to get a little bit more of a pressure down towards the floor. I could also, if I was having trouble with my lateral glide or my ulnar glide, I could position the wrist as such, and then I can put my weight through it like that, if that gives you a better grip position, okay? Or we could do our radial or ulnar glides from this position if this is where you feel like you get better strength from. But again, it's a pretty easy joint that you should probably be able to just do everything right like this, okay? But you have options, which I've put into your handouts for anyone who's having any issues, like this bottom picture right here. If you are not happy with just doing it with the palm facing down, you could change and go into a more vertical position. Okay, so you've got lots of options. Then what we do is we go into the CMC joint. So make sure you find the actual CMC. So you have to kind of walk down the carpal, or excuse me, the metacarpal, until you find the carpal. Now this could be like a goalkeeper could injure their thumb. Okay, anybody who works with their hands. Basketball players, you take a ball the wrong way, right, and you can really hurt any finger. Usually it's the middle finger or the longer of the fingers in the hand, not as much the thumb, but skiers, snowboarders, anybody who uses their hands as part of their sport can get the CMC involved. This is something also PTs tend to get a lot of thumb problems later in their career if you don't use your hands properly over time. Okay, so when you have that CMC joint, what we're going to do again is just create like our grade distraction. We're going to go anterior, posterior, medial, lateral. And you're just going to try to move it just a little. Remember, there's not a huge amount of motion here, but you do have to identify. So here's the end of her metacarpal, which makes this her CMC joint right in here. Okay, so we do a little distraction, little anterior posterior, and then little medial lateral. So you just want to make sure, if you've had a sprain, if you've had a fracture, if you've had surgery, this is all going to be very stiff. And that's where joint mobs can come in handy, okay? Is to restore that mobility to the thumb. Then likewise, if you take each finger, and we'll come back to the thumb here, but if you take each finger and you do a distraction, medial lateral, AP. Okay, you take each finger, distraction, AP, medial lateral. They should all give a little. So if someone took a ball the wrong way, dislocated or sprained a joint, you're going to want to make sure that they get that mobility back, okay, that you're doing some soft tissue work along the ligament, you'll stabilize it, you'll be taping it, but you're going to make sure that that joint comes back fully. If anybody has ever dislocated or sprained a knuckle, you'll know the knuckle fattens, it has a lot of restriction in it, sometimes it's hard to create the full grip again, and that's where manual therapy comes in, okay? So you can take each of the metacarpal phalangeals. Here's the first, again, it's a distraction, okay? There's your traction. You can go medial lateral, AP. You also have a little rotation in there, which you can also do for each of these. Okay, so that's how easy this is. And then you just go along from 2, 3, 4, and 5. You want to distract it, AP, medial lateral, and if you want to add a little rotation in there, you can. Okay? When you take, if you ever take a Mulligan class, they're going to go through all the hand. They do all the motions here to help you get it back. Very, very simple in the hand. We're going to keep it very simple. Here's your grade 1 traction. Again, taking it into like a medial and lateral glide.